joined this since April now, and I've worked in various hospitals previously. So this is different actually because here we don't refer them as a patient as such. First, this is the first and foremost thing, that we don't refer them as a patient, and we don't focus on what deficiencies or what inabilities they have. We focus more on what things they have. We don't focus on what they are lacking. And you can see the environment. This doesn't look like a hospital, and this looks like, they come here as if it is a farmhouse and it's their vacation spot. And we plan those sessions that the patients, they feel that it is not an exercise. Okay, they don't feel it as an exercise. They take it as a fun activity. So that is how I feel that this is different from the hospital setup and the ambience that they have, and they have maintained it so well. So this is how it is different. The Midway is different. Mostly there are, this is a neuro rehabilitation. We take most of the paralysis patients, acute stroke cases. So patients, either they come from home or directly from the hospital. So we admit both the category of the patients. So mostly post-surgery, pre-surgery cases, like we have TKR, like total knee replacement patients also. We have stroke patients who have inability to do activities, hand function activities they have lost, or leg activities they have lost one half, or paraplegic patients, both the legs are not working, or spinal cord injury patients we have. We have bypass surgery patients over here. So pre and post orthopedic cases, we do admit them. Whoever who requires the rehabilitation post surgery, or even if they require a rehabilitation prior the surgery. So most of the doctors, now the awareness is more, so the doctors, they do recommend patients before surgery also. So the patient has to go under particular rehab, then they go under surgery, and then they come again to the Midway, like that. Yeah, we do have many cases as such. Like usually doctors don't give, like they don't refer it like there's no hope. They always do give hope, but the thing is, like, how much is the prognosis? Is it good or is it bad? The acceptance should come from the family, that this particular patient, it doesn't have such kind of condition that it would have a good prognosis, or how far the progress would go. So that acceptance sometimes the family doesn't have. But the thing is that there are many cases which they have surprised us in a way, that we thought that probably, for example, there was one patient, I would not take the name, but there was one patient, we were expecting that the leg power would come in 3 months or so, or 4 months or so, like how we medically think about it. But the patient, surprisingly, he recovered within 15 days. He was walking without any assistive devices, or like any whatever we prescribe them, the AFOs or the push knee braces or anything, he didn't take any of it, and he was already walking. So such things happens, which is miraculous, and also the efforts of everyone, like their relatives, the doctors, the Midway team, everyone.